how amputation contributed in the advancement of medicine during World War I, crossing frontiers in the medical field.
Amputation was a very important medical procedure during World War I. This frontier of amputation was the reason thousands of soldiers had a higher chance of surviving. The amputation frontier was invented in the 1st century, but amputation was commonly used in the 20th century during World War I. Archduke Franz Ferdinand of Austria was assassinated on June 28, 1914. After that, World War I started on July 28, 1914, when Austria-Hungary declared war on Serbia. Within a week, Russia, Belgium, France, Great Britain, and Serbia had lined up against Austria-Hungary and Germany, and that's when the frontier of World War I had begun. It mainly took place in Europe. Germany began fighting World War I on two fronts, invading France through neutral Belgium in the west and confronting Russia in the east.
Department of Veterans Affairs. The United States Department of Veterans Affairs is the executive branch of the federal government, which provides lifelong health care services to eligible military veterans. This department was established shortly after World War I due to veterans having trouble gaining jobs. It was officially settled March 15, 1989. The United States Department of Veterans Affairs is located all over throughout the United States of America. The Department of Veterans Affairs is significant to the frontier of World War I because Congress established a new program with benefits towards veterans with disabilities, such as amputation. These benefits included insurance for service personnel and veterans, and rehabilitation for disabled veterans.
Amputation. Amputation was one of many medical advances, along with ambulances, antiseptic, and anesthesia in World War I. It was one of the most common medical procedures in World War I because soldiers' limbs would often get shattered by shrapnel and needed to be amputated to save the soldiers' lives. Many thousands of limbs were amputated by doctors to save lives. It is estimated in Germany that the number of amputations totaled 67,000 and 41,000 in Britain. Many of the soldiers believed that they would rather die than be maimed, but the doctors at the fronts saved many thousands of soldiers through amputation. Limbs were amputated for a number of reasons. They were often shredded as a result of shrapnel, fragments of a bomb or shell, or explosions. Machine guns shattered bones in arms or legs. Compound fracture, where the bone was shattered and projected through the skin, was a complex wound, and the limbs were often amputated. Often there was no bone left to join together, and the threat of complications such as infection meant that amputating the limb was much safer for the patient. On the Western Front, amputations were conducted in cases of trench foot, which was caused by poor foot hygiene and immersion in trenches full of water.
Traumatic amputation. When soldiers would come to nursery tents, one of the most common accidents was traumatic amputation. Traumatic amputation is a loss of a body part due to an accident or injury. Traumatic amputation was solved by amputating above the injury to make a clean cut to make it look neater. Traumatic amputation caused by a bombshell or shrapnel. A clean cut was made above the skin and tucked in to make it look neater. Traumatic amputation was not only affecting the body, but it greatly affected the mind. The scarring or trauma from the injury made the soldiers mentally unstable. Due to all of the surgery and pain, soldiers suffered from insanity, depression, and severe anxiety. Soldiers were almost terrified to look at themselves with the stumps. The stumps reminded them of the pain and suffering and loss of the limb. The stumps are the remains of limbs.
Prosthetics. The earliest signs of prosthetics were in the 16th century. Allies were a surgeon. Ambrose Pare was the first person to create a prosthetic. Prosthetics made a huge impact on the world by helping many who lost their limbs regain mobility, allowing them to have an easier time going on with their day-to-day life. Prosthetics made a remarkable influence on the lives of amputated soldiers by affecting their physical appearance in a positive way, which lifted their self-esteem.
Allies. During World War I, amputation was performed by using a guillotine. During the Battle of Somme in 1916, Marmaduke Shield, a senior consulting surgeon who treated many military casualties after they returned to England, wrote that post-amputation pain was a source of intolerable suffering to his amputee patients and a despair to those who fit them with artificial limbs. He later called for surgeons not to use the guillotine method, reporting that it left nerves exposed, causing both stump pain and poor prosthetic fit. In the following year, fellow surgeon Captain Huggins advocated a two-step amputation with surgeons in Britain, performing a second procedure to reduce pain after the initial operation at the front.
Process of amputation. Today, instead of resorting to amputation in the first instance, surgeons use a technique called debridement to remove soft tissue, preserving as much of the limb as possible. Phantom limb pain, which is the pain the soldiers felt in their missing limbs, is now understood to be a consequence of how the nervous system adapts to damaged nerves and the loss of a limb, and affects around 59% of amputees. However, it is still poorly understood and difficult to manage.
Blast injury. In Paris of 1917, Augusta Deckering-Klumpke, a neuroscientist, arrived for work. Her work was at a hospital ward for injured soldiers. Everyone in the rows of beds had lost limbs in the war. The men were fitted with new limbs made to fit their stumps properly. But when they went home to their families, their stumps started to swell and become red. Manageable pain became unbearable and their new limbs simply wouldn't fit anymore. The patients were back in wheelchairs and crippled. No one could understand why. Doctor after doctor handled their stumps, prodded and poked them, then stood back confused. There was no infection, no nerve damage, no reason why the restoration would be failing. In the final year of the war, the neuroscientist Augusta made a breakthrough. She had been taking x-rays of the failing stumps, one of the first uses of x-rays in medical research. It had been noticed that what had once been neatly healing bone ends were now jagged and rough. It wasn't the bones themselves, but the growth over it. It was the tissue surrounding the bone. Nerves, blood vessels, and especially muscles. What had been soft tissue was becoming hard tissue, becoming bone itself. This new hard tissue affected the nerves and the stump, causing it to swell and become painful, destroying the neat profile that had been used for the prosthetic fit. Augusta noticed something else. All the soldiers had been injured in the same way. They had not been injured by gunfire or stabbed. They had been brought down by a powerful blast of heavy shell fired from a large artillery weapon. Augusta theorized that it was not only the metal fragments and shrapnel that had injured the men. The actual blast wave of energy from the explosion somehow affected them, and it was still affecting them long after their original injuries had healed. Then, back in 1918, the Great War ended. End of World War I. At the 11th hour on the 11th day of the 11th month of 1918, the Great War ends. At 5 a.m. that morning on November 11th, 1918. Germany signed an armistice agreement with the Allies in a railroad car outside Compiègne, France. The First World War left 9 million soldiers dead and 21 million wounded. Germany, Russia, Austria-Hungary, France, and Great Britain each lost nearly 1 million or more lives. In addition, at least 5 million civilians died from disease, starvation, or exposure. World War I was known as the war to end all wars because of the great slaughter and destruction it caused. Unfortunately, the peace treaty that officially ended the conflict, the Treaty of Versailles of 1919, forced punitive terms on Germany that destabilized Europe and laid the groundwork for World War II. Amputations in the modern era. Amputation saved many soldiers' lives by removing the infected part of the body. Luckily, with the advancements of science and modern technology, amputations are now performed with better surgical procedures. Doctors now give the patients anesthetics and they perform safer and faster surgeries to remove the limbs. The doctors take extra precaution to prevent bacteria from going into the patient and have a better understanding of nerve endings that give amputees a higher rate of survival. This day and age, amputations have evolutionized lives to include sophisticated state-of-the-art prosthetics. Patients' treatments also evolved and include physical, emotional, and life skills supported with their new prosthetics, helping amputees live a more fruitful and enjoyable life.